My name is Matthew Adams, and I'm the Government Affairs and Coalitions Manager at the Competitive Enterprise Institute. For those of you joining us today from Capitol Hill, I'm the man behind the frequent CEI government affairs emails you likely get each week. For those unfamiliar, the Competitive Enterprise Institute is a DC-based think tank that focuses on regulatory policy from a free market perspective. Today is Tuesday, December 19th, 2023. It has been over 3.5 years since we entered lockdown because of the coronavirus pandemic, and it has been over 4 years since COVID likely made it to our country. I think all of us can agree that the pandemic is over and that life has mostly returned to normal. Over the past year or two, we've learned an immense about what went wrong before, during, and after the pandemic. One of the things that has become abundantly clear is that the Centers for Disease Control and Prevention, the one agency whose sole job is to control and prevent public health crises, failed. This fact has been acknowledged by public health experts, lawmakers, and even the CDC director herself. We're here today to talk about why CDC failed, and more importantly, how Congress can go about reforming the CDC so something like this does not happen again. Joining me today is Joel Zinberg, both a doctor and a lawyer. Joel is a senior fellow at the Competitive Enterprise Institute and the director of the Public Health and American Wellbeing Initiative at Paragon Health Institute. In a joint paper for CEI and Paragon, Joel examines how and why the CDC failed and proposes reforms of how Congress can fix the agency. I should also mention that the paper was co-authored with Drew Keyes. Drew worked with Joel at Paragon, but was most recently left to join Speaker Johnson's office, where he now heads their health policy shop. I'll let Joel talk about the paper in just a bit. Before I do so, it is my pleasure to introduce Congresswoman Mariannette Miller-Meeks. Rep. Miller-Meeks represents Iowa's 1st District in Congress and serves on a number of important committees relevant to today's discussion, including Energy and Commerce and the Oversight Select Committee on COVID. A veteran, doctor, and public health expert herself, Congresswoman Miller-Meeks has distinguished herself as a conservative leader on a number of important issues, including healthcare and public health. Most recently, and fittingly, she led an initiative to solicit stakeholder feedback on how best to reform and improve the CDC. Before I hand it over to you, Congresswoman, I do just want to take a moment and remind everyone that there is time dedicated at the end for Q&A. You could use the chat box function in Zoom or email events@cei.org to get those questions to us. I should also mention that this briefing is being recorded and will be posted online for later viewing. All right, thank you again for joining us today, Congresswoman. I really appreciate you finding the time to talk with us, especially considering the House is in recess and the holidays are just a few days away. Without further ado, it's my floor is yours. Thank you.
I was going to say I'm going to apologize for dressing casually, but I am in district and I'm traveling and it's cold here in Iowa. So,
well, you guys are in session for quite a few weeks this fall, so you definitely earned it.
Yeah, we were, but first and foremost, I want to thank you all for inviting me to join you today to discuss reforming the CDC and to discuss how we can shore up the agency for the next pandemic. As both a physician and a former public health director, I take public health very seriously, and I recognize the important role that the CDC and state health departments play in keeping Americans safe. In April of this year, I released last year it would have been, I released a CDC request for information to the public and hundreds of stakeholders requesting feedback on how to sensibly and effectively reform America's top communicable diseases agency. I am not one of those who think that we should just end the CDC and it plays no role or no function. Not surprisingly, as you've already elucidated, public trust in the CDC is at an all-time low. And public health experts across the nation have presented many suggestions on how to rebuild that trust. During the pandemic, much of the CDC's guidance did not appear to emanate from data and scientific evidence, especially real-world evidence that was being accumulated at the time and during the pandemic, especially what we were learning from Europe and from Israel. But rather, it seemed to come from political interest, such as clear coordination we saw between the CDC and the American Federation of Teachers or Teachers Union on the school reopening guidance. Despite clear evidence that children were not likely to transmit the virus, and we had this very early on in 2020, it was one of the truthful things that the Chinese Communist Party had provided. The CDC's reopening guidance would have at least partially closed 90% of schools in the country. the guidance would have closed tens of thousands of schools that had safely been open for months. And Iowa was one of those because as a state senator, I provided information from the American Journal of Pediatrics to our state senators and to our governor so that we could safely reopen our schools in the fall of 2020, which we did. They were 50-50 in person and remotely. But there were many schools, especially in rural areas, that reopened completely for in-person learning. The tactic that the CDC, and even if they say, well, we didn't force schools to be closed, we just provided guidance. Nonetheless, when the CDC says this is our guidance, it is taken as a mandate, and it's unforgivable. And even now, there's still not an acknowledgement, a full acknowledgement that number one, they parroted the talking points of the American Federation of Teachers Unions, and number two, that was inappropriate guidance. So, but to the CDC's credit, they have recognized the declining public trust, which led Dr. Walensky to launch the Moving Forward initiative. This effort included reorganization and requests for sweeping new data collection authorities from Congress. While the CDC hasn't been forthcoming to Congress, at least in my view, about the reorganization, the CDC at least acknowledges that the agency faces significant structural and systemic operational challenges, and indicates a central goal to create new internal processes, systems, and governance to empower leaders, align incentives, and hold the CDC accountable. For those of you who listened in to the hearing we had most recently on the Energy and Commerce Committee with the new CDC Director, Dr. Cohen, she indicated that transparency, operational efficiencies were most important. But at the same point in time, she didn't even acknowledge that the former policies of the CDC and the same things that she implemented within North Carolina as Director of Public Health were wrong. And so for me, what I received from that was that she would have done the exact same thing as the former CDC director did during the pandemic. Now, most importantly, the CDC was created in 1946 as a communicable disease center. And this was the focus of my questions during that hearing, with the mission of preventing the spread of malaria, but has since grown into a massive bureaucracy with a $9 billion budget that supports research and initiatives which are not within the communicable diseases landscape. This includes millions of dollars for firearm injury, mortality prevention, and vastly other things that has become not just the CDC, but the CDC and P, so for prevention. And as a director of public health, I brought forth our state board of health, members of the community, and the healthcare profession who were actually very concerned that our state public health department reorient to its original mission, which is preventing communicable diseases. Now, also when the CDC was formed, if you remember, this was at the end of World War II, in between the Korean War and the start of the Cold War. So there was also a focus, very importantly, on national security and preventable diseases and bioterrorism. And that since has been eroded as well, too. So how this massive expansion of the Centers for Communicable Diseases, or the CDC, now the CDCMP, how that benefits public health. Everything has now become public health, but it's actually population health masquerading as public health. We know that obesity is not communicable, that drug abuse per se is not a communicable disease, or heart attacks or stroke. Now, these may all be very valid things for a larger, nationwide organization to address, but it is still outside of the original scope of the CDC. And many of us are concerned that it takes away their focus on public health and communicable diseases, and most importantly, how to translate research that they receive and real-world evidence research from other countries into a recommendation while we're in the midst of a pandemic. How do they move rapidly? How do they move efficiently? How do they translate that information that they're gaining into public health recommendations in real time? So I don't say this lightly, and I don't say it with satisfaction. The public mistrust of the CDC has increased. And one of the things that we have to do is to regain that public trust. We need to have an organization in the United States that can look at the research, translate that research, help develop testing, help develop recommendations. And I would also like to say that what I found in my own state our local public health agencies, and we have 99 counties in Iowa. We actually have 101 local or county public health agencies. But the trust in those individuals, because often they're within a community, is much greater than the trust in the overall CDC. So with that, I would say I'm looking forward to this conversation. I'm looking forward to the questions. And most importantly, I'm actually looking forward to learning from you all as well.
Fantastic. Thank you so much for giving us that great overview, Congresswoman. Joel, before I turn it over to you for your opening remarks, I did want to give you a few minutes to respond and build on some of what she just had the chance to say.
Yeah, so, I like the Congresswoman, who, by the way, is to be commended on the fabulous work she has done in this area. We at CEI and at Paragon wondered what happened, what went wrong, how can you explain it? And just to flesh out some of the things Congresswoman Miller-Meeks said, the failures that were acknowledged by former CDC Director Walensky were really from start to finish. At the outset of the pandemic in January and February, the CDC had a data collection system that they were supposed to communicate with the states about incoming threats from overseas. That failed. It was taken offline in February. In February, the CDC sent out a flawed test, and in concert with the FDA would not allow any other testing to take place. So for the month of February, we were essentially without a test as the virus spread around the country undetected. As the Congresswoman mentioned, they were spreading really false information, misinformation around the country about a variety of topics, about the efficacy of various mitigation measures, about school reopening, about the possibility of natural immunity, which they played down, with the result that we had all sorts of first responders who didn't want to ultimately be vaccinated were kept off the job, and many of them fired because they would not, even though they had natural immunity from previous infection, they were therefore unable to work, and we're still dealing with that problem.
Absolutely.
So failures were really legion throughout, the pandemic, and they continued well into the pandemic, well after it was apparent that much of the information they were providing was false, well after it was apparent that their data collection and dissemination system was so bad that the de facto standard became the Johns Hopkins dashboard, which was created by a single graduate student, whereas you had an agency with an over $10 billion budget and 15,000 employees couldn't do it. So we wondered what's going on here? What was the problem? And we looked at the history of the agency the way the Congresswoman outlined it, and it grew from this original 1946 agency, started in the executive branch to combat communicable diseases, and it grew within the executive branch in a haphazard, crazy manner, so that it now includes all sorts of diverse agencies, institutes, centers, having nothing to do with communicable diseases, that overlap with all other agencies in the government, and in many cases have nothing to do with health altogether. So you have an agency that's dealing with social justice, with racial disparities, with climate change, and the relationship between these things and health is at best attenuated. And arguably, an agency founded to combat communicable diseases and keep the country safe from them has little or no expertise in those areas, which other agencies within the federal government do have expertise. So we wondered, how did this happen? And one of the interesting things we found out was that CDC, unlike many other or most other federal agencies, has never been authorized by Congress. And it was an amazing thing. And for your audience who may not realize it, the way Congress, which has give the constitutional power of the purse to determine spending, acts generally through a two-step process. They first authorize agencies, where they set out the goals of the agencies, they set guidelines, they establish oversight, and then they do what are called appropriations, where they provide the money. And Congress has actually not done that from most of the never done it for the agency as a whole. It's done it for only 3 of the CDC's 12 centers and institutes. And as a result, we have this agency focused on everything but infectious disease. In fact, we found estimates that 8% or less of the agency's resources are focused on dealing with infectious disease issues. And that became apparent during the pandemic. So this lack of focus left the agency unprepared for the pandemic, and it distracted it from an effective response. And this actually became very apparent during congressional testimony from former CDC Director Redmond and Admiral Giroir, who was the ASPR, the Assistant Secretary for Health, who was supposed to be dealing with these sorts of issues. And they said the CDC lacked focus, and they attributed the poor performance of the agency to that lack of focus. So this is an important issue, important because we know there's going to be another pandemic coming in the future, whether it's pandemic influenza, whether it's an uptick in COVID, whether it's something we completely is unexpected. We know something like this is coming. There's no question about it. It's not a question of what, of if, it's only a question of when. And we need an agency that can effectively respond. And we need an agency that has the public's trust. Otherwise, the public will not adhere to those recommendations. So it's terribly important that we reform the agency. And what we ended up recommending in this report is that Congress take the hard work of going center by center, institute by institute within the CDC, see which ones overlap with other agencies. And we have a detailed several page examples of agency overlap, and I can go into that later. Determine where these various functions belong, take them out of CDC if they don't belong there and better performed by other agencies. For example, NIH, which has tremendous overlap with CDC, actually is authorized by Congress, and most of its institutes are much better funded for these particular areas than the CDC centers and institutes. And also there are going to be areas where CDC, they properly belong within CDC and things should be moved, like NIAID, the National Institute for Allergy and Infectious Disease, has overlap with CDC and arguably belongs there. So it's going to require that sort of center by center work by Congress to refocus the agency, streamline it, and make it a more effective tool going forward in the future.
Beautiful. Thank you for that, Joel. And just to recap for our audience there, the paper Joel wrote and is discussing here is co-authored with Drew Keyes, who now works for Speaker Johnson. It was published by CEI and Paragon Health Institute. Title is Unauthorized and Unprepared. Joel gave a really great overview of all his findings there, but just to focus on some of the top line things, the reason CDC failed throughout COVID-19 really was because of the mission creep and the duplicative programs and the overall lack of focus that they have. Was that accurate, Joel? Do you think that's a?
It was indeed. I'm glad to see you read the paper.
Yeah, of course. Of course.
We termed it as mission creep, and it was mission creep abetted by this lack of congressional authorization, and also abetted by the fact that you had a public health agency that, as most agency does, wants to expand. And it was also coming at a time when public health agencies were seeking to expand their reach, arguably into areas that had very little to do with public health and more to do with sort of the broad terminology of social determinants of health. So all of these things conspired, but it all grew up within the executive branch, unfortunately with little oversight from Congress, other than the fact that Congress was appropriating money, but without that, the oversight of authorization.
Thank you for that. And that lack of authorization is really, I think, what we should focus on today, because it really is the next step that Congress needs to take a look at into preventing this from happening again. So Congresswoman, you did mention this at the beginning of your remarks. I did want to turn back to it to discuss a little bit more about the RFI that you had with Chairwoman Rogers on energy and commerce. Would you be able to share any of the feedback you've gotten from there?
Well, a lot of the feedback you've actually heard. And so, and I didn't want to elucidate all of the failures of the CDC, but first and foremost, and I'm going to add to it, it's not just a lack of authorization. There is a lack of focus, but there's also an arrogance. Being the premier agency in the United States that's supposed to handle communicable diseases. So I'm going to add that in there. And we saw that in testimony with both Dr. Walensky, with Dr. Fauci of NIAID, and then with Dr. Cohen. And, both Dr. Walensky and Dr. Cohen, I like them. I respect them. I think that they have robust resumes and, amazing backgrounds, but nonetheless, the failures in testing. The CDC could have easily worked with the University of Washington, which had already developed a test. It didn't have to develop its own test. It could have worked with with research laboratories, with our research institutions, academic institutions, rather than delay us by 6 weeks for the testing. They've acknowledged that, but they haven't acknowledged that they could have had a public-private partnership to do this. Their acknowledgement is, yes, we failed, but they want to maintain it and still center it within the CDC. And then that was a failure of both CDC and FDA. Infection-acquired immunity. This is, for me, I think, that was so pivotal in causing me to lose trust in the CDC. When we had, asking Dr. Fauci and Dr. Walensky about herd immunity and infection-acquired immunity, and it's a common public health concept, but you would have been led to believe that no one had ever heard of this before. It was still research and anecdotal, and it was so mind-boggling that it caused even those of us who have been in the arena, have been educated, or of a science background, that we even started believing we were wrong. It was so pervasive, this attitude. And then even later on the select subcommittee on the coronavirus crisis, we again had 5 public health individuals. I again asked them about infection-acquired immunity. Every single one of them downplayed infection-acquired immunity. And the physician even said, well, we vaccinate people all the time that have already had disease. Look at shingles. We don't vaccinate children who have had chickenpox with the chickenpox vaccine 2 weeks after they've had the disease. And so even now, and what we would hear play in hearings was that we don't want people going out and having COVID-19 parties. No one was suggesting having COVID-19 parties, but you had a very expensive vaccine. You had a shortage of a vaccine. It was a worldwide virus, a pandemic, where you needed to have resources utilized around the world, but yet they're recommending that we vaccinate people who have already had the disease. It was so much that I actually put forward and sponsored a bill. I couldn't get it passed, but a bill on requiring all insurance, public and private, to cover antibody testing. So antibody and T-cell antibodies, which are what you see in viruses, because it was so bad. Vaccine mandates. The CDC will say, well, we didn't mandate the vaccine. Well, in essence, you did mandate the vaccine. And the failures of the FDA. So I know we're talking about CDC reform, but if you recall, the FDA, 2 of their members on their board that recommends quit over recommending boosters, and especially boosters in young individuals. Therapeutics, the CDC failed when it came to therapeutics. When I first read about hydroxychloroquine, it was in March, just as the pandemic was starting. It was in March of 2020. I was tracking what was happening in South Korea and their caseload, and saw a mention at the CDC website about anti-malarial drugs and SARS, the original SARS, not SARS-CoV-2. Linked onto the article, which led me to an NIH article. Later, that article was removed, but it was because I'm wondering, since I have patients for 30 odd years on hydroxychloroquine and Plaquenil, and I monitor them for visual changes, why would an anti-malarial drug be effective in SARS or a virus? And then last on masking, and school closures. So all of those were failures. And I think the information we got from individuals was an agency that had lost focus on infectious diseases. And I think part of that was as we conquered infectious diseases with vaccines, with treatment, the CDC enlarged in order to keep, I think, like most agencies, in order to keep funding and keep relevant, because you don't have a continual urgency of infectious diseases and preventative public health from that standpoint. So the nimbleness, translation of research, focus on communicable diseases, and then this tie with national security, which has been lacking. And, who has that? Whose responsibility is that? Department of Defense said, no, it's not their responsibility. The CDC didn't have that function. They weren't looking at it from a bioterrorism standpoint. I'm not suggesting that it was bioterrorism in any way, but we know that that is an avenue that we have to look at. And when we had our hearing on origins of COVID-19, only the Republicans showed up for that hearing. And Admiral Gerard, and if you know the witnesses, we had witnesses from the Heritage Foundation, Admiral Gerard. It was interesting to see what work China had been doing on viruses and bioterrorism. So that's a long soliloquy. I'll be quiet there, but the focus is that we received was refocusing the agency, nimbleness, translating research into recommendations, acknowledgement of therapeutics and real world evidence, things that are coming across, testing, public-private partnerships, utilizing clinical laboratories throughout the United States for testing. And then my personal is, and I think Dr. Zinberg mentioned the funding to the CDC and how much of it goes to public health. When the House passed President Biden's ARA, which was the COVID-19 funding, that $1.9 trillion, less than 0.5% went to public health. And of that, where the focus should be is on non-competitive public health grants, which help stand up your local public health agencies that allow them to function and be there and be present when there is an epidemic or a pandemic. And that's where money should be going. And that's where the trust happens to lie.
Great. Thank you so much for that, Congresswoman. Oh, Joel.
Matt, I just wanted to expand a little bit on what the Congresswoman said. And, the sort of recalcitrance of of the agencies, particularly CDC, but to some extent FDA and other agencies as well, had real consequences. It's not merely that we didn't get testing fast enough or that people were lost trust or misled. Some of their failures actually led to disease spread. I mean, they were always several months behind the literature, and they seem to have an agenda to do things like deny natural immunity, to push vaccines, to deal with mitigation measures that had basically no evidentiary basis. Things like masking, business and school closures had really been debunked before the pandemic. There was a very influential article from Dr. Henderson and his colleagues at University of Pittsburgh in 2006 saying that these mitigation measures don't work, but they do have tremendous downsides. But CDC seemed completely unaware of this. It was relying on terribly flawed models because it had very little, by the way, very little modeling capability of its own. So it was doing things like looking at the Imperial College of London model, which was completely flawed and alarmist. And they lent credence to these lockdown measures, which we know were incredibly harmful. In fact, in another paper entitled Freedom Wins, we did an empirical study comparing the severity of lockdown measures with health outcomes, economic outcomes, and educational outcomes. And what we found, there was no significant relationship between the severity of lockdown measures as measured by a third-party index. The Oxford University has a government response index, which they publish, and that's what we relied on. There was no significant relationship to health outcomes, but there was a tremendous negative impact on economic outcomes and on educational outcomes. So we know that this and well, exactly. And exactly. So we know that these CDC failures had real consequences. And it's important that we don't go down that road again, that we're prepared in the future. And another, thing that struck me as the Congresswoman was speaking was that when you listen to their responses, it just reinforced what we wrote in the paper. We cannot rely on the CDC to reform itself. There are multiple reasons why, but I can tell you that number one, bureaucracies almost never do. As Aaron Wildavsky, the famous political scientist noted many years ago, all they want to do is expand, not contract. There's no effort to rationalize their existence and performance. They never want to cut in funding, and that's the case here. And we know that the CDC has completely misdiagnosed their failures. They did a report called Moving Forward to look at their performance during the pandemic, and they say their problems during the pandemic were due to communications problems and lack of funding. So, I mean, this is despite the fact that they were the best funded in their history. There was over $26 billion of additional appropriations for them over the course of the pandemic. But they are asking now for more money because they performed so well with that money during the pandemic. They need even more. But in fact, the failures were not lack of money. It was incompetence and lack of focus. And that's what we want to do. And we know, by the way, that the CDC will resist any kind of reform measures unless that they're imposed on them. About 20 years ago, the CDC tried to reform itself after the anthrax scares, and they undertook a big study. They suggested certain measures, and the CD staff rebelled, and it forced the CDC director to abandon all the reform efforts. So unless the CDC is not going to do it by itself, the only folks who can do this are Congress. And that's why we suggested that congressional hard look, center by center. And by the way, I would add that since then, there have been additional few factors that I think are important if we have another emergency situation. Part of the 2023 appropriations bill included a new White House Office of Pandemic Response. And it also created ARPA-H, which is an agency within NIH to study things, to study pandemic measures and biologic measures. And there's tremendous overlap with the existing structure that was created by PAPA, the Pandemics and All Hazards Preparedness Act, back in 2006. So now you have these multiple lines of authority that it's completely unclear what's going to happen in the next pandemic. You have a White House office, you have ASPR, which is in HHS, and was originally created as an assistant secretary position, but the administration has bumped it up to a separate administration within HHS on a par with CDC and FDA. It's not clear who's supposed to take the lead. You have other organizations involved like FEMA, Department of Defense. No one really knows. And now you have ARPA-H, which overlaps with BARDA, with another creation of the Pandemics Act, which is supposed to be researching these countermeasures and for infectious disease and pandemic response. So I think part of what Congress will hopefully do is provide us with direction on where the lines of authority are.
Very much so. Thank you for that, Joel. We're at 12:35, so I do just want to take a moment and remind everyone that if they have any questions, they're welcome to submit those in the chat box through Zoom or to email events@cei.org. Joel, I did want to go back to one of the points you raised a moment ago, which is talking about how Congress can go about truly bringing about the reform that is needed at CDC to prevent something like this from happening again. It seems to me that there are three main tools in Congress's toolbox to go about doing these types of things. There's the appropriations process, which they've done a little bit. There was the rider in one of the appropriations bills this year that would require the CDC director to be confirmed by the Senate by 2025, I believe. So there's, riders and other mechanisms they could use through that. It's probably hard given the political climate right now. There's, of course, oversight, and Energy and Commerce and Oversight Committee and the Select Committee on COVID have done a great job really holding people's feet to the fire to get the answers, to figure out what went wrong. Again, that can only go so far. So it seems like the third thing they could do is legislate on this. So Congresswoman, you of course have your boots on the ground, working in the trenches, doing all this type of work. I was curious what ideas you have for reform in terms of legislation. I know there's talk about introducing some of the FDA good guidance reforms to the CDC.
So I think that is one of the topics of conversation, and I think it would be beneficial. The hearing we had on energy and commerce, and specifically my testimony, was geared to the CDC, focusing on communicable diseases, on its original mission, on what is true public health. And I think Dr. Zinberg's correct, is that having overseen an agency much smaller, with a much smaller budget, here in the Department of Public Health in Iowa, that agencies in and of themselves aren't going to reorient themselves, and it's extremely difficult to reorient that ship. The other things that we can try to get some handle on is its responsiveness to Congress. I mean, as the Doctors Caucus, as members of Congress, we also were relaying information both to the CDC and to FDA on some of their recommendations, and asking them to look at, it's not just their ability to do research, but how do they translate research from other countries in the midst of a pandemic. So authorizing the agency is certainly one of the things that Congress can do. And tying the funding to that authorization and the focus with which they want them to have. We did, just pass legislation on ARPA-H. PAPA we're still doing, and it's extremely difficult. We don't have the Senate and we don't have the White House, but even under the PAPA reauthorization, it's always been bipartisan, but the Democrats wanted to focus on drug shortages, which don't have, was that an issue in the pandemic, with supply chain issues, with antibiotics not being produced here, with the Chinese Communist Party hoarding PPE, swabs, testing reagents. Yes, that was an issue, but nonetheless, drug shortages shouldn't be in PAPA reauthorization. Again, we're, expanding the scope of an agency, or an authorized program. And so I think we're trying to maintain some control over how expansive these get. And then it's the question of whether or not ASPR should be within the CDC, or ASPR should be a separate agency. ASPR may be able to be more nimble if it is not within the CDC, and it maintains its structure as it has. I like Dr. Zinberg's suggestion about utilizing the NIH more, which is a research component. A lot of it goes to grants to universities or other programs, other types of agencies, if you will, other research. But, is there an avenue to move NIAID from NIH to CDC? And would that better allow them to focus and integrate both the academic research, the laboratory clinical research, and then what happens with recommendations. So I think that's an interesting thing that, in reading their paper, is something that we could facilitate.
Joel, I wanted to turn it to you for a sec. I know in the FY 2024 budget, the admin requested a 25.6% increase to CDC's budget. That would bring it from just around $9 billion to $11.6 billion. I know some of the talking points out there are that, this would help CDC be more prepared for the next pandemic. We need additional resources. Do you think that's an accurate talking point? Do you have any faith that the CDC would actually put those resources into preparing? Or is this just a grab to shove more funding into all the other social justice and other duplicative programs and mission creep programs you've talked about before?
Well, I always like to point people to that moving forward report that CDC created to look at their pandemic performance. And they state proudly in that report that in April 2021, when she was brand new in the job, Dr. Walensky stated that her most important goal was to integrate social justice into the agency, to every facet of the agency. And look at racial disparities, etc. Now, that may be an important goal. I don't know that it belongs in the CDC. More importantly, April 2021 was a period in time when we were just had vaccines. The agency, the administration was struggling to convince people to get vaccinated. And this was their greatest achievement, to integrate social justice into every facet of the agency. That to me says that they really have no idea of what went wrong during the pandemic. They think, this lack of focus, where you have less than 8% of the agency's resources focused on infectious disease in the middle of the biggest public health emergency in 100 years, they think that's normal. So to me, that says giving these guys more money is a real waste of time and a waste of resources. You have to look back and say what belongs in this agency. And as the Congresswoman said, this is an agency whose main focus, its core mission, is supposed to be on protecting the country from infectious diseases, whether from abroad or within the country. And yet, it's focused on everything but. And as I said, we have a tremendous section in the paper dealing with the areas of overlap. If you strip those out of the agency, you may find that you actually save money. You don't need more money. You need less money going forward. So I think it's a very misguided idea to just ask for more money. It's absolutely the wrong thing, and it just feeds the misconceptions that the folks who are apparently still running the agency and in the administration have about what the proper role of the CDC is in our healthcare system.
And to Joel's point, altering the director, whether the director is Dr. Cohen or Dr. Lewinsky or Dr. Redmond, regardless of who is the director, you still have the entire agency, which may have a certain philosophy, or they may be enamored with a certain program. And what you're saying on the social justice, our mission statement when I was in the Iowa Department of Public Health included social justice in our mission statement, and trying to work that out among our staff was challenging. And then if we can learn something from 9/11, where there is overlap, the question is there communication? Do we have communication between these different programs, whether it's ASPR, whether it's NIH, whether it's FDA, whether it is, PAPA and BARDA? Where's the communication between these, and is there appropriate levels of communication? And that's one of the things that Congress can help facilitate too. And so I think that there's not this conversation between the agencies, between the different programs, where there's actual information that you need ongoing. You need the nimbleness to be able to translate that into actual recommendations and how you're going to guide the public during an actual emergency, not in the times in between emergencies. And then the national security focus, which we don't have anymore. And then how do we get that back into the CDC and working with whether it's the intelligence communities. And we tremendously saw that in looking at the origins of COVID-19. And why is it important? I know that the press, when we would mention it, you could tell that their eyes were glossing over. But why is it important? And I'm just going to reiterate, the reason why we need to know origins of COVID-19 are because there is an international case for 24-hour immediate disclosure. That is a requirement. We need to know the ethics of types of research that's going on, especially if we're having to fund them, i.e. gain of function research, which was prohibited, and then Fauci and Collins pushed for it to be funded after its 2-year hiatus. And then third, and that is the safety of biosafety labs. So is the appropriate type of research being done? So the international community and the CDC has a vested, and NIH has a vested interest in knowing origins because of those three things.
Yeah, and I would add that this lack of communication has real consequences because, CDC, like NIH, functions primarily as a grant-making organization.
Correct.
It funds research by outside organizations. So number one, if at the very basic level, you could have a lot of duplications funding the exact same area as NIH, which is wasteful. But more importantly, it could be functioning in the exact opposite area. So you could be working across purposes between the two agencies. So it's important that you remove that duplication, or at least rationalize it so in a way where there are specific functions for specific agencies, not where they're just duplicating the same thing and wasting a lot of time and energy and perhaps working in a destructive direction.
We're coming up just on 1 o'clock in 10 minutes. So before I turn it over to you both for 5-minute closing remarks, I did want to turn it over to the audience and ask a couple of their questions that we have. This one comes from Chris Hess, and he asks, can you speak to CDC pandemic planning that rejected lockdowns as a preventative measure?
So if it's addressed to me, I'm not sure exactly what the question is asking. I don't know that the CDC has yet come to the conclusion that lockdowns didn't work. And, our strategy should have been, after the first 6 weeks or so, we pretty much knew who was at risk, who was most harmed, and should have adopted a strategy where we protect the most vulnerable. So that means the elderly, people over age 65, people with pre-existing medical conditions, younger people if they had pre-existing medical conditions or things that made them more vulnerable to SARS-CoV-2, that those are the individuals that you want to isolate. The CDC has done a plethora of research on masks. We should have been honest and transparent. I think that's the best tactic to take, and that is, if the concern was we don't want people going out and buying N95 masks or KN95 masks because we need them for healthcare providers, then we just say to the public, a mask has some limited benefit. It may protect you. It may help to reduce the amount of viral load if you're infected with any type of viral entity, but their effectiveness is limited. We recommend them if, in these situations. I mean, there's ways that the CDC could have tailored that information. On lockdowns, I still don't know that they have really come to the conclusion that lockdowns didn't work. I certainly did not hear that conveyed to me in the most recent testimony by Dr. Cohen, the current CDC director, at our last hearing at Energy and Commerce. I think they've come to some, realization of infection-acquired immunity, but literally I would have to show them the video clips of what they said for them to honestly acknowledge that they downplayed infection-acquired immunity. Now, why that is, I can't go to the motivation on why they downplayed and or acted if it didn't exist. And I'll give you an example of how pervasive this is. I have been testing my antibodies. So I had the initial vaccine. I vaccinated people in our counties. I have never agreed with the vaccine mandate. I think that we eroded the doctor-patient relationship when we had the mandate supersede patients talking to their doctors, young people, forcing them to get vaccinated either to go to school or to go to college or to get a job or to travel. We eroded the ability of doctors to have conversations with their patients, to have some kind of risk-adjusted strategy, risk benefit. And it wasn't until 2022 in a conversation with the Doctors Caucus that Dr. Walensky brought up risk and benefit. And I told her, with all due respect, it's the first time you've mentioned risk benefit when it comes to the vaccine. And it's critically important that there is a risk benefit analysis or recommendation. I have been testing my antibodies. I went in last December, had my antibodies tested again because I was going to be traveling overseas. And so I had my antibodies tested, and instead of a week to get the results, it was 3 weeks later. I still didn't have the results. When I finally got the results, they then asked me to come in to see the house attending physician. I did that. And so they gave me the results. I have real strong antibodies, but they still recommended that I get the next booster, the most recent booster. I go, well, why would I get the booster if I have strong antibodies? Now, imagine if you're an average person and you don't even know you can test your antibodies or that you should get them tested. And I said, I'm not getting the booster. I already have strong antibodies. What's the purpose of a vaccine? The purpose of a vaccine is to confer immunity. If you already have immunity, you don't need to get a vaccine in order to confer immunity because you already have it. And so that's the narrative where I still don't think within public health and within the higher levels of authority, we have actually acknowledged and internalized the mistakes that were made during the pandemic. So I do have concern without proper oversight, and especially of the Republicans who are pushing the proper oversight. And we do have Democrats on the select subcommittee of the coronavirus crisis that have also acknowledged this. Dr. Amy Barra is one of them, that we have to prepare the scenario for the next pandemic and make sure that we have the right precedents in place, not to lock down, not to have vaccine mandates, not to deny infection-acquired immunity, and most importantly, to use the real-world information, evidence, and research. They were not masking kids in Europe. Kids were in school in Europe. We knew that the duration of time between the first and second dose should have been expanded, which conferred better immunity. We still don't have all the adverse outcomes and acknowledgement of those. As you know, the CDC downplayed that there was an increased risk of myocarditis and pericarditis from the vaccine, especially in young men, as related to the pericarditis and myocarditis you might have seen if you'd gotten COVID. So I still think there requires robust oversight and or legislation, as been alluded to earlier.
Yeah, I would add to that simply that before the pandemic even started, every country had policies and plans for how to deal with a new pandemic, including the United States. And none of those plans included the type of lockdown measures we saw. And the World Health Organization's recommendations didn't include those types of recommendations. And there was, when people talked about, oh, well, what happened in the 1918 pandemic, we had some lockdowns there, that was completely misleading because the lockdowns there were very spotty. The average length of lockdown was a month, not year, not 2 or 3 years, but a month. So no one was recommending these things before. And it's somewhat understandable that perhaps at the outset, when we didn't know what we were dealing with, people were going to be overcautious. But as Congresswoman said, we learned very quickly on who were the vulnerable people. It was the elderly. It was people with multiple underlying conditions. We learned early on that kids were not specifically vulnerable. In fact, they seemed to be relatively unscathed by this and that they would recover unless they had some underlying medical condition. But we didn't adapt. We had a public health administration essentially that was unwilling to look at the costs and benefits of this. And that was the real problem, that unfortunately you had public health take over when they should have been policymakers who were looking at it to balance the risks and benefits and the costs and benefits of any particular policy. And we let the certain public health figures ride roughshod over those policymakers, and we can't let that happen again.
Thank you for that question, Chris. We've got just about 5 minutes left, so I want to be respectful to everybody's time. So I'll go ahead and turn it over to you, Congresswoman, and then Joel, just to give a quick recap on some of your thoughts today.
I actually think you should take another question, and I'll try to be less verbose. But first and foremost, I really appreciate you, Matt, and Joel, Dr. Zinberg, for doing this, for putting this on. I think without the proper oversight, without the proper acknowledgement, we're doomed to do the exact same thing we did. So my time in the military tells me that your past, your past conduct then becomes the precedent going forward. Are there things that were beneficial? Operation Warp Speed, how we dual tracked things to get a vaccine out and available. And I know there's all kinds of negativity over the vaccine, but I'm also going to say the vaccine did help to reduce people's hospitalization, ICU admissions, and it did help save lives. Now, is it a vaccine like the typical vaccines we think about that has a long duration of conferred immunity? No, it is not one of those. And is it going to be more like influenza? Yes, it'll be more like influenza. The vaccine mandate was wrong and it was inappropriate. We said so at the time. I continue to believe that it was. So, where we are on lockdowns and school closures. I mean, I've had to repetitively talk about in Congress that the reason why the Las Vegas school system opened up its schools when they were closed was because between March 16th and June 30th of 2020, they had 6 suicides. Between July 1st and December 31st of 2020, they had an additional 12 suicides, the youngest of which was 9 years old. So to pretend that lockdowns had no effect, our school closures had no effect on individuals. We correctly predicted in 2020, I wrote articles on it, that disease from cancer would increase, death from heart attacks, strokes, vascular disorders, diabetes would increase, that drug use, abuse, and overdose deaths would increase, anxiety, mental health, depression, and suicide would increase. All of those things have unfortunately come true. And we have to take a hard look at that. And again, as both of us have said, to look at the risk and benefits. Who are we trying to protect? What are we doing to our economy? What are we doing to our health? What are we doing to our mental health? And as relationship to children, what are we doing to their resiliency and their learning and their education? And how does that affect us going into the future? And I think it is critically important that we get this right so that we can institute the correct policies in the future.
Thank you, Congresswoman. Joel, we got about 2 minutes.
Okay. So, we saw that there were multiple failures from start to finish in the CDC, which was our nation's preeminent and most respected public health organization, an agency that was specifically supposed to be focused on dealing with communicable diseases like the pandemic, and which failed to deal with those. And that failure had real consequences, not the least of which was the various lockdowns, which, as the Congresswoman and I have described, had devastating economic outcomes and particularly devastating educational and mental health outcomes. Our students have lost years of education. They're struggling to catch up. And these were losses that most severely impacted the disadvantaged communities. Poor people whose families are from poor educational backgrounds, they have suffered disproportionately from these lockdown measures. And we need to look carefully why this happened. I think we've shown conclusively in our paper that it was the lack of focus by the CDC, a lack of focus resulting from the fact that the agency has never been authorized. It's grown haphazardly into a large, diverse agency looking at multiple areas, few of which have anything to do with communicable diseases, areas that are duplicated in other agencies. And if we continue that lack of focus, the agency is going to remain unprepared for the next pandemic and will perform just as badly in the next pandemic as it did in this past one. So it's time for the Congress to act, to refocus the agency, make sure that we are prepared, make sure that we have an efficient, streamlined structure where the lines of authority are clear among the various and sundry agencies we've mentioned today for the next pandemic. And I'm hopeful that with people like Representative Miller-Meeks, we will, in fact, get there.
Thank you for that, Joel. Well, I tell you, after today's conversation, CDC reform is at the top of my Christmas list this year. Probably not going to happen in just a few days, but maybe next year. That'll be a nice gift. Thank you again for joining us today, especially to you, Congresswoman. Really appreciate you finding the time. And I encourage you to keep up all the great work you're doing on this issue. And we definitely look forward to working with you into next year to help advance these reforms.
Well, thank you all very much. Thank you to everybody on your call today. And then Merry Christmas to you all and a bountiful, prosperous New Year.
Thank you, Congresswoman. Merry Christmas to you too. Before everybody else hops off, I do just want to remind everyone that CEI's next online event will be on January 4th. That's going to be looking at pharmaceutical benefit managers and looking at why congressional efforts to regulate them are unwise. I'll make sure everybody who attended today gets a RSVP link for that. And then before we close out, everybody should be getting a feedback survey. So if you have any feedback on how we can continue to bring you really great events into the new year, please do fill that out and let us know. With that, thank you all for joining us today.